Influenza and RSV are back with a vengeance. Please wash your hands and take the appropriate precautions. I'm Rob Freelove, Senior Vice President and Chief Medical Officer, Salina Regional Health Center.
Doctor, thank you so much for joining me today. Let's talk about the impact COVID, flu, and RSV are having, right now here of late.
Sure. So it's the first full week of December, and we are, to be honest, we're getting absolutely hammered with influenza, RSV, and COVID is still there. It's still at a high community transmission rate. Right now we have more people in the hospital with influenza than we do COVID. It's really created some problems, especially RSV with kids. We're seeing a lot of kids that are sicker, seeing a lot of kids who need hospitalization. We're seeing some kids that need a higher level of care than even what we're able to provide. And we're having delays in getting those patients transferred out to larger hospitals or children's hospitals because they're so full of kids with RSV. It's not too late to get a flu shot. And I encourage everybody to go get one. Our flu shot rate nationwide is maybe 20 to 25%, so really, really low. And the flu shot this year does appear to be pretty effective for the strains of influenza that are going around. So go get your flu shot. It's not too late. It takes about 2 weeks for that to kick in, but we are just in the beginnings of flu season. So if you haven't been vaccinated for influenza, go get vaccinated. And as far as COVID, you can still get vaccinated for COVID. You still should. And if you're eligible for the booster, please go get the bivalent booster.
Let's talk about the hospital visitor policy and how it's evolved throughout COVID.
We've opened up as much as we can. We're in a tiered model, so depending on what the community transmission rates are, we have different openness to visitors. Right now we're at high, so we're at our most restrictive. We're not screening patients or visitors at the front door, but we are asking them to screen themselves. Please, if you are sick, don't come visit somebody. You may have COVID, you may have influenza, you may have RSV, whatever you have. If you come in and you give that to your loved one who's already sick and compromised in the hospital, all you're going to do is make things worse for them. That would be the first thing. So we're not screening, but we are asking people to screen. We're asking people to wear masks in the hospital still. We are allowing 2 visitors in at a time now. So we've loosened up on a few things in a few areas where we can, but right now we're still at that high level and are kind of at our most restrictive. That's something that we look at every week, and we kind of can adjust the visitor policies based on what our transmission is. We did have 1 week we were not high, and that was a glorious week, but we've been high since then. So you can find those on our website as well.
Thank you so much for some great information. And thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.